continuing in our journey in the internal reproductive anatomy of women, of females. All right, we're going to talk about the uterus and fallopian tubes and ovaries. The uterus is located in the pelvic cavity. And when you're not pregnant, it's only about 2 ounces, but when you're pregnant, it increases in size greatly to about 2 pounds. Non-pregnant, about 3 by 2 by 1 inches, but that's going to hugely increase in order to hold sometimes a 10-pound baby. So that's capable of great degree of change in size and volume. It's shaped like an upside down pear, and there's different areas to it. The ones I want you to know that the cervix is the wall between the vagina and the uterus, and the hole that's going to dilate to open up. This little hole is about the diameter of a drinking straw. It has to open up to about 4 inches to let a baby through. That's called the os. And there's no homologous structure in males. Remember, the default anatomy is female, and so the clitoris becomes a penis and the labia becomes a scrotum. The ovaries are comparable to the testes, but boys don't have a version of the uterus. So some gushy pictures coming. So, uterus, ovaries, fallopian tube. This is the cervix and the os. Cervix and os, that's the opening. And it's covered with cervical mucus. So it's kind of, so we're looking through the vagina here to the cervix. And there's the os. It's covered with a kind of mucus. That mucus is going to thin out around ovulation to make it easier for sperm to get through. The walls of the uterus, we're going to go from innermost to outermost. Innermost layer is the endometrium, and that is, you keep building that up in order to, during your fertile years, it's going to thicken every month so it can accept a fertilized egg and feed it and provide nutrients and support. So it's epithelial cells and glands and capillaries, and it grows every month, and every month that you're not pregnant, you shed it, and that's what you're shedding during the menstrual flow. The middle layer is the myometrium. There's 3 layers of smooth muscle, and these are some strong muscles. They have to be, if you've ever had cramps, you know they're strong muscles, but they have to be strong enough to expel a baby through that little hole. And the outer layer is the outer perimetrium, and it covers the body, part of the body, not the cervix, because you don't want to have it covered so the menstrual flow and the baby can come out, so the entire uterus isn't covered. But it's going to help keep cushioning on the uterus and keep it from rubbing against inside the abdominal cavity. So the functions of the uterus. It's a passageway for sperm. Sperm come in through the vagina, cross the uterus, and then pick a side on the fallopian tube. If the egg has been fertilized, this is where the embryo and then the fetus will develop, and it's going to help protect it and provide nutrients for it. Strong muscles to expel the fetus when it's time. And then if there isn't a fertilized egg, if there's no pregnancy, you're going to shed that endometrium that you've built up every month, and that's shed during menstruation. And secretion, you're going to make proteins and sugars and fats, prostaglandins, and that's prostaglandins are going to affect smooth muscle contraction, so they're going to help during menstruation, and they help widen the cervix during labor. The uterus is going to make beta endorphins for pain relief, and they also make anandamide. Anandamide is your body's natural form of cannabis, basically. It's an endocannabinoid, maybe for pain relief, but really your endocannabinoid system plays a role for all of fertilization. It helps the sperm swim and find the egg. It helps the egg implant in the uterus. It helps the fetal development. It helps the fetus learn to suckle. The baby learn to suckle after it's born. Your endocannabinoid system is really involved with fertilization. So some bad things that can happen to the uterus. And I have a trivia. Even though only half the population has one, the uterus is the site of the 2 most common surgical procedures performed in the US. So that would be cesarean section, a C-section, and hysterectomy. Two most common surgical procedures are performed on the uterus. All right, let's talk about some bad things that happen to the uterus. Fibroids, hysterectomy, cancer, endometriosis. So fibroid tumors, they are not cancer. Okay, it's a benign growth, and they are really common. At least a quarter of women over the age of 30 have fibroids, and it may actually be closer to half. And by age 50, 80% of Black women and 70% of white women may have fibroids. So these are very common, so don't panic necessarily if you have one. They can hurt depending on where they are. Sometimes they can get to be quite big. They can be grapefruit size or bigger. And if you have too many, maybe they can interfere with implantation of a fertilized egg. But the largest, it's not a trivia, but the largest one on record was removed in 1888. It weighed 143 pounds, and the woman died after surgery. Don't let it get that big, but they are common, so don't panic. It's not cancer. It's a benign growth. But it is one of the more common reasons for a hysterectomy. Hysterectomy is the removal of the uterus, and it's very common, especially in America. America, we kind of like surgical solutions much more than other countries. It's now about 6 times the rate of hysterectomies done in America than are done in Europe. At least 600,000 women have it done every year. That works out to be more than one every minute of every hour of every day in the United States. 1/3 of women have had a hysterectomy by the age of 60. Now, if it's for cancer, yeah, okay, you got uterine cancer, take it out. But 40% of the time it's due to fibroids. Now, some of the time it might be indicated, but you do not, doctors sometimes want to do it because it's easier to take out the whole uterus than to take out a fibroid. But if you want to have kids, or you don't want to have your uterus removed, whenever somebody wants to take an organ out of your body, get a second opinion. That's just a good basic plan. And so we do them hysterectomies more for fibroids than other countries do. Let's see. You can just take out the uterus and then the cervix as well. Sometimes they'll take out the ovaries too. And if they do that, usually they do that for cancer, then you are now in menopause. If you're 30 years old, they've taken out, you are suddenly in menopause, surgical menopause. And if you're young, you're probably going to want to take hormone replacement drugs, but that is up to you and your doctor depending on why they're removing your uterus. Sometimes they actually have to take part of the vagina as well, but that's going to be due to cancer. All right, other bad things that can happen to the uterus: cervical cancer. Don't worry about the incidence, don't worry about the numbers, but it is a slow growing cancer, and usually it's viral based. HPV, human papilloma virus, can greatly increase your risk of this cancer. They learned that kind of when they found that nuns and Jewish women didn't tend to get it as much, and they think HPV was carried more with men with a foreskin. I don't know, it was a theory, but now we have Gardasil. Gardasil is a vaccine against HPV. It's been out for, Gardasil's been out since 2006, I believe, and HPV infections among women has reduced more than half. It was I think 60% reduction. It was great success we're seeing with this. There's a new Gardasil that protects against 9 forms of the HPV virus. The old one was just 4 forms, but it still covers most of the virus, the HPV that causes genital warts, and most that cause cervical cancer. It's not 100%. There are still forms of HPV that can cause it, and sometimes you can get cervical cancer without HPV, but HPV is an incredibly common virus, easily passed, really common, but we are seeing a great reduction in cervical cancer and warts as well because of Gardasil. Last uterine pathology, endometriosis. That's when endometrial tissue detaches from the uterus and it actually lodges in other parts of the body. Usually it's right near the uterus, but it can be in leg muscle and in very rare cases and even get into the brain. Now, this endometrial tissue is going to respond to hormonal signals. So as the hormones travel throughout your body, the estrogen and progesterone, this endometrial tissue can grow. So if it's there in your leg tissue growing, that can cause pain, you can get bleeding, and the incidence has greatly increased. In 1920, there were 21 cases reported in the world, and sure, they weren't diagnosing as much. 1996, 6 million cases in the US. 2014, 176 million cases around the world. So huge increase in prevalence. Now, some of it is more diagnosis, more awareness, but there's something else going on. We don't know what. Environmental pollutants, we don't know what is going on, but it's becoming more and more common. All right, moving on to other parts of the internal anatomy. Fallopian tubes. They're about 4 inches long and they are attached to the uterus. So this is an open tube. Here's the ovary. It is not directly attached to the ovary. Now let's just name all these parts first. This is the vagina. Here's the cervix, is number 2. The uterus is 3. Number 4 is the fallopian tube. 5 is the ovary, and this ovary is attached to the ligament. And number 6, these are called the fimbria. They're like little fingers, and what happens is you release the egg, poo, and the fingers kind of sweep and go whoosh, whoosh, whoosh to try and have the egg get swept into the fallopian tube. Sometimes it doesn't make it, but you want to have it get swept into the fallopian tube, and then it'll get fertilized if a sperm is there in the fallopian tube. The function of the fallopian tubes, it's going to carry the egg from the ovary to the uterus, and this is where fertilization occurs. And that fertilized egg travels about 1 inch a day, so it doesn't get there whoosh right away. It takes a few days to get there. Tubal sterilization. We talked about vasectomy in males. This is sterilization in a female. So what it is, here's the uterus, fallopian tube, and ovary. You cut the fallopian tubes, and they used to tie them off. That's what it used to be called, getting your tubes tied. Hopefully now they cauterize the ends, because otherwise what can happen is sperm comes in, goes through, and sperm are teeny weeny little cells. Sometimes the sperm can make the leap, and your egg has been released from the ovary into the fallopian tube. It's traveling, and if a sperm makes the leap, that can fertilize the egg here, and it's not going to make it. The egg is a big cell. It can't make the leap, although it's not 100% successful. It's about 99.9% successful. So sometimes, or 0.5%, sometimes it can make the leap. I've known a couple of people whose moms had their tubes tied and they were stillborn. But if the sperm makes the leap and the egg can't, that's a fertilized egg here. That's called an ectopic pregnancy. It is not compatible with life of the baby, and 10% of maternal death is due to rupturing the fallopian tube. But it is rare, but it can happen. So tubal sterilization, you cut the fallopian tubes, you still ovulate, you still get your period, you still have orgasms, you're just preventing the egg and sperm from meeting. And they go in laparoscopically to do that. Ovaries are comparable to the testes. You have 2 of them, about the size and shape of an almond, and this is attached to the uterus by a ligament. And inside the follicle, inside the ovary are oocytes and follicles. And I think in the next time I'll actually be seen so I can describe what's going on. An oocyte, that's going to be what we think of as the egg. That is what's going to get fertilized. But as it grows in your ovary, it grows surrounded by other cells. So your oocyte, that's your egg. That's going to get fertilized. When it's growing in your ovary, the oocyte is surrounded by hormone-secreting cells. Together, the oocyte and those hormone-secreting cells is called a follicle. So a follicle is bigger than an oocyte. The oocyte is like the center of a follicle. Oocyte, plus hormone secreting cells that surround it is called a follicle. The functions of the ovaries. The ovaries are going to release the oocyte. Specifically, it's called the secondary oocyte. We'll get to that. It's going to release the oocyte, the egg that's going to be fertilized by the sperm. So the release is called ovulation. And the ovaries themselves, it's also an endocrine gland. It's going to secrete estrogen and progesterone. So think of the testes. Testes make sperm and secrete testosterone. Ovaries make eggs and release estrogen and progesterone. Bad things that happen to ovaries. Ovarian cancer. Ovarian cancer is one of the more fatal cancers. It has a higher mortality rate than some other forms of cancer because it can take longer until it's diagnosed. Because if you look, don't worry about the numbers. Don't worry about if it's 5th or 30th. Don't worry about that. But it's fairly non-specific symptoms. Swelling of the abdomen. You feel a little bloaty. Who doesn't feel that every once in a while? Pelvic or back pain. Oh, I've moved a couch. Maybe that's what's going on. Vaginal bleeding in between your periods. And persistent GI distress. A lot of these you can excuse it. You can think, oh, it must be this or this or this. But please don't ignore these symptoms, any of these, because it can be a sign of ovarian cancer. And if you catch anything earlier, it's much better. But sometimes it's already metastasized before it's been diagnosed here. So if you catch it while it's still in the ovary, you got a 90% 5-year survival rate. But once it's metastasized, that rate goes greatly down. And you increase your risk factor with a family history of ovarian cancer. Diet, we're unsure about what diet. I personally think high processed food, high carb is bad for you, but smoking cigarettes, bad for you. Never giving birth. Giving birth and being pregnant protects actually a few different kinds of cancer just because the levels of hormone. So never giving birth, you have a higher risk of ovarian cancer. And we will close this one out with just a review of the anatomy. So on your test, there will be something probably to label. So this is the this is the uterus. Don't get the uterus confused with the bladder. So number 1 here is the uterus. Number 4 is the bladder. Here is the cervix, and the hole is called the os. This is the vagina. Number 4 here is the bladder, and the tube leading from it is the urethra. This little nubbin right here, the clitoris. This is the ovary, and 8 is the fallopian tube, and these are the fimbria. So let's close it out, and we will talk about oogenesis in the next video.